When a loved one reaches the end of life, it can be a really scary situation for those around them, the loved ones. And a lot of this is due to myths and different things, but there's also services that can kind of dispel some of those myths and help make end of life a little bit better. Here to talk to us about hospice is the medical director at Good Shepherd Hospice, Stuart Stein. We also have Becky McIntyre. She is the Chief Clinical Officer there at Good Shepherd Hospice.
Hello.
Thank you guys for joining us today.
Thank you.
Thank you.
Well, first of all, before we get too far into all the different services and things that are available with hospice, tell us a little bit about Good Shepherd and kind of where it comes from.
Good Shepherd Hospice has been in the Polk, Highlands, and Hardy County area for over 30 years. And we're not-for-profit, freestanding hospice, serving patients regardless of their age, their sex, their creed. We don't discriminate against anyone. And we also take care of patients as young as newborns all the way up to the elderly over the age of 100.
Wow. Now, tell us a little bit about hospice. I mean, what is hospice really? What do you take care of?
Sure. People are going to answer that question very differently. You'll get answers when you ask somebody what is hospice that range anywhere from, oh, it's a building, it's a place where people go when they are diagnosed with a terminal illness. And other people will say, well, no, it's a program, it's a healthcare delivery system. And it's all of those things, but really a better description of what hospice is a philosophy. It's a philosophy that we apply as people enter or are given a life-limiting diagnosis. And when I say it's a philosophy, we're shifting the emphasis. Typically in medicine, in mainstream medicine, our focus is on curative therapy and life prolongation to the maximal extent possible. In hospice, we shift that and we concentrate really on managing people's symptoms and improving quality of life. So managing things such as pain and other symptoms such as shortness of breath, anxiety, and we also address psychosocial and spiritual issues that people are faced with at end of life.
I'm sure that there's a lot of different variables to each patient, obviously depending on whatever the diagnosis is, whatever the illness might be. Also, the family that surrounds them. What are some of the things that you help the family with?
Well, families are faced with a lot of difficult choices. Oftentimes, families find themselves in the situation of being the decision maker and trying to imagine what it is that their loved one would want to do under these circumstances. As I'm sure you can imagine, oftentimes people's illnesses progress to the point where they're no longer really able to express that.
Right.
So that's a tremendous burden. It's also very common for families to have differing opinions on what the patient would want or what is best for the patient under the circumstances. And we help to provide a lot of support for families who are going through all of that.
Absolutely. We have the support that's at the time of while the patient is alive, and we have support coming in the home, as well as after a patient passes away. We continue supporting that family, whatever family is, and we're there for them to help them through that grieving period. And like Dr. Stein said, the beauty of hospice is there is no exact prescriptive model. It's based on what the patient and the family want. And so many times in medicine, we feel like we're, if you will, victims of things that are being done to us. Well, in hospice, we try to give that control back to the patient and families and say, what do you want? What is quality to you? How can we help you? How can we come alongside?
Who do these services pertain to, really?
Well, we're very, very lucky in that we are able to provide services to people who have life-limiting illnesses when the prognosis is less than 12 months. In most states, those services really can't be provided until you're in that 6-month window. So we're very fortunate that we're able to work with people for longer periods of time. And we take care of people of all ages, as Becky said just a moment ago. We have newborns, and we have people over 100 years old on our program with various diagnoses. So.
And I think that's probably something a lot of people don't think. When they hear hospice, they think of elderly,
Yes.
and not necessarily, younger generations that are diagnosed with an illness.
Definitely. And one of the other myths is that we hear that people think that it's only for those who have cancer. And certainly we do assist patients and families with that diagnosis, but there's other end-stage diseases related to heart disease, liver, lung disease, emphysemas, along with your cancers and things. So it's not just a support for a cancer family.
There was a time actually when cancer was the majority of patients who were referred into hospice programs. That's really no longer the case. And in fact, one of the areas where we've seen a lot of people realizing what hospice has to offer is in the area of chronic debilitating neurological illnesses. Such as everything from ALS, Lou Gehrig's disease, to Alzheimer's disease, Parkinson's disease, these types of things.
It seems like the more it just seems like over the years people have become more aware of the different types of diseases and how to handle them and take care of them. Is that affecting who you see being admitted into hospice? I mean, do people tend to stay with their families longer with the information that's available on how to care for these individuals, or do you still see people being admitted into hospice, very quickly?
Well, I think our goal has always been to keep people with their families and in their homes. Of course, that's not always possible, but that is what we work toward. Even when people do require a higher level of care for a period of time, our goal is to get those symptoms under control, whether they're physical symptoms or spiritual symptoms, and then continue to provide those services, but once again back in the familiar home environment and with the supportive family and loved ones around you. So,
now, is it possible to be admitted into hospice for, like you said, maybe those severe examples, then working through those and getting those symptoms under control, come back out of hospice to be with the family? Or, I mean, how does that work?
I think he's talking about the hospice house.
Yes. Hospice, like Dr. Stein was mentioning, is a care model.
Right.
And we go to wherever the patient is. So we actually can provide hospice care in a hospital, in a nursing home, assisted living, in a home setting, homeless shelters, on the street. We take hospice to wherever you call home. And within that, we do have several areas where we can help you. So things like our clinical care centers, our hospice houses, where we do help that patient and family with those symptoms to get them under control. Maybe short term, their goal is to get back home, but they weren't able to get those symptoms controlled at home, and so it's like a short stay and then they come back. But going back to our guiding map is, what does the patient and family want? So we continue to ask that, and most patients will say, like Dr. Stein mentioned, I want to be home. I want to be with my family, my dogs, want to be able to see the view on the lake, to watch the birds. That's quality to me. And so we try to help that family and that patient get back to that setting.
How does, with Good Shepherd, how does somebody access the services that you provide?
Well, someone can self-refer if you get some news at your doctor that you might be you might qualify for the program. You can self-refer. A friend or loved one can refer you. Your physician may refer you. Clergy, anyone can pick up the phone and make that referral. We will then go ahead and have somebody come out. One of our nurses will come out and do the assessment in your home or your place of residence. We'll try to do that within 48 hours. We can obviously rally the troops if there's a more urgent need and do that in a much shorter time frame. And then hospice care starts very shortly thereafter.
So it's actually a very simple process
to
get it started.
It is. And one of the things that we see from surveys that we do with families after a patient dies, we hear back frequently, I wish I had called sooner. I wish I had entered hospice sooner. I had no idea all of the things that you could offer. So one of the things we would like to encourage patients and people in general to do is go ahead and have that conversation with your medical provider. Say, doctor, when the time comes, if I have a terminal diagnosis, I'm okay with you referring me to hospice. And that way, that's telling your medical provider in advance, this is what I would like for myself. Right. And they do appreciate that.
Yeah.
You know, one thing I think people worry about too is after they have been on a period of time, because they hear us using terms like 6 months, a year, well, what happens if I go longer than that? And actually, there really is no finite limit. If
Right.
somebody has an underlying illness, the disease is continuing to progress and slower than we anticipated, that's really a good thing. And we can continue to provide hospice services as long as that person continues to require hospice services.
Yeah. Now, when we talk about the hospice services, obviously you said there's a lot of psychological things that go on. There's a lot of fears, and so obviously you're offering some peace of mind to families and to the patients. But as far as the health care that comes along with it, how does hospice differ from, like, say, a hospital or whatever?
We use an interdisciplinary team approach. I don't think I use that term, but we're very proud of that. We didn't pioneer that concept, but I think we've perfected it in hospice. Unlike most other disciplines, we sit down at the table weekly and discuss our patients, and at that table we have a physician, an RN, healthcare, health aides, home health aides, volunteer services, social services, clergy.
Oh, wow.
We also have the ability to bring in pharmacy and dietary as needed, and other therapy modalities to help coordinate the care for this patient and share our experiences with the patient, make sure that we act as a coordinated team and treat the whole patient, and not just the disease, not just the symptom, but the entire patient and their family and loved ones.
So you're actually not just looking at the patient through a single lens, but you're gathering information from all different points of view, all different disciplines, basically.
Correct.
To develop the best possible strategy for healthcare.
Yes.
And always, again, at the bottom of that driving our plan is, what does the patient and family want? And I like to use the analogy of a house. When you look in the different windows of a house, it's still the house, but you see different perspectives. So by bringing that team together, we're all looking at the different perspectives, whether it's spiritual pain, physical pain, psychosocial pain, and helping to come up with a plan that meets what the patient's and family's goals are.
Now we get kind of into the sticky situation that everybody wants to know but never wants to ask. What kind of costs come with hospice care? I mean, with all the doctors and registered nurses and all of the different people involved, just like we just said, dedicated to these patients. What kind of costs are incurred with this?
That's an excellent question, because it is a very rich benefit, if you will, as you can see with all of the services that are provided. In addition to the medications that are related to the hospice diagnosis, the equipment that may be required, and other expenses we really haven't even touched upon. But Medicare and Medicaid are two of our larger sources of our payment sources, but in addition, most private insurance will cover hospice, and we would never turn somebody away because of lack of ability to pay. So we actually have, we provide over $1 million in free care.
And that's part of what our fundraising efforts are directed towards, is providing that care for what we call the unfunded patients, so that everyone has the opportunity to have that same level of quality hospice care.
And that's terrific. For anyone who might be at home watching right now, and they're thinking, is hospice the right move for my family? Is this the right move? When should somebody start to consider hospice? Obviously, we talked about your time frame, but that's a tough decision for somebody to make. When should they start to think about hospice?
Yes.
In medicine in general, we tell people that really that's a conversation you have when you're feeling well. You don't wait until the 11th hour. Because you can approach these things more rationally.
Right.
What is it that you would want? What is it that you would not want? Obviously, there's a state do not resuscitate form that that crosses many fields of medicine. All institutions offer that to patients, but it's just not that simple. There are all types of level of care decisions that need to be made, including whether or not to maybe utilize hospice services. Also, part of that conversation should really be, would I want to be on a ventilator? Would I want to have dialysis? Maybe I want to have antibiotics, but I don't want a tube implanted.
Right.
These are conversations that I think we should all have with our loved ones so that they would know if we were unable to speak for ourselves.
The truth of the matter is we're all susceptible to illness. Kind of shifting gears just a little bit, and we briefly mentioned it after the patient has passed. There's obviously some family members, there's loved ones that are left with funeral care and things like that. Obviously, the emotional burden that goes with losing a loved one. What are some of the things that you do for family members and loved ones after the passing?
We have a wonderful bereavement department that is staffed by clinical social workers and a licensed therapist. And what they do is we offer the service to the survivors of whether you're a spouse, a friend, children, grandchildren, and the therapist will come to the home, work with you, and then we do also have group settings through multiple locations in Polk County. Where it's always nice when you're with a group and you're sharing some of your situations and you find out, my goodness, most everyone in this room had that same feeling. It sort of normalizes a little bit some of the issues that you may be dealing with. One of the things that we are very proud of in Good Shepherd is our camp that we offer for children called Camp Braveheart. And that was started over 10 years ago by a local physician who lost his wife to cancer. And one of her goals was to make sure that there was support for her children after she died. And so it was named in her honor, and we call it the Bethany Center. And we are able to take children to Camp Circle F Dude Ranch for a long weekend. They don't have to be what we call hospice survivors. So these children could have lost a grandparent in a car accident, a sibling to drowning, but they're dealing with grief in some fashion. So they go to camp, they have fun as kids, but they also get to talk about their emotions, which again, you can imagine, not every child is dealing with this.
Yeah.
And so it's not something they want to talk to their peers with many times. They hide those feelings. And so we found that we watch their school grades and some of the ways that they act out, children do, and when you peel back all those layers of that onion, many times you find that there's grief issues that are unresolved there. So coming to camp, being normal, playing and seeing, oh my goodness, that girl lost her mother also, and you can identify and talk about those things. But our camp is funded, we work very closely with the United Way. We do receive funds from United Way, and very excited to work with them in that manner, but that helps us with things like our children's camp and providing those services, because there is no funding for that.
Becky, you had mentioned a little bit about the hospice house. You kind of touched on that. That's a pretty big service.
Yes.
Tell me a little bit more about what the hospice house is.
Well, the hospice house is a place where our patients go for symptom management. So it's what we call short-term. It's not a long-term placement like an assisted living or a nursing home, but patients go there to get their symptoms under control so that they can go back home if that's where they choose to go. We hope that patients will choose that setting instead of going to the emergency room or the hospital. Most patients don't want to go there, and so we give them that option of a place to go to have those symptoms treated. Exciting for Polk County, we are in the midst of building another hospice house or inpatient facility in Lakeland on Lakeland Hills Boulevard. We hope to have that completed in the fall, and it will have 16 beds to serve our patients here in Polk County. From
what I'm gathering, that's kind of your philosophy, is to make life, even the last days, more enjoyable.
Absolutely. We say that death is just as normal as birth. and we try to treat it that way as far as involving family, having a home-like environment, family staying with you. It can be a very beautiful time for families when we're there to support them. One of the things that we try to do is help our patients with some of their fulfilling some of their wishes that they would like to do, and we ask them that question. Had an example of a over 90-year-old that lived in Sebring actually, and one of her goals was always to ride in a race car. Well, my goodness, the Sebring racetrack is right there. So we worked through with our chaplains who had contact with the chaplains with the racing group. We were able to get her to the racetrack, and no, she didn't get to drive the race car, but she was able to ride in the race car with the helmet, and family was there, pictures, and it was just such a time of celebration for her.
That's great. That is so great. Guys, thank you so much for coming on here today and telling us about hospice care.
Thank you very much.
That's the Good Shepherd Hospice. Terrific services that they provide, very much needed services. And, you know, it can be a scary thing, but these guys are here to help you through it and to kind of dispel some of the myths around hospice. If you need to get in touch with them, it's really simple. Just give them a call, look them up online. You can find them online at chaptershealth.org, or you can call them at 1-800-544-3280.